Who knows what a physiatrist is? Physiatrist. It's a bit of a crazy person. They don't train physiatrists in Nebraska. That's a physical medicine specialist. And briefly, I'm from California, so I'm one of those nuts and fruits from out there. And I went to 4 years of college, went to UC Berkeley and did a degree in something called medical biophysics and learned a lot. Wish I should have spent more time there, but I was young and foolish and left and graduated me, and that's life. And then I went to medical school in Southern California at the California College of Medicine. And spent 5 years there, including 1 year where I more or less did clinical research. I spent about a year with a neurologist thinking that I could cure Alzheimer's disease. I did not learn how to cure it, but I did learn how to spell it. So that was a successful year. And then I did what's called 6 years of postdoctoral training. First I did primary care pediatrics. And I consider pediatricians real doctors. Primary care physicians are, in my book, real doctors. They have to take care of the whole person. And that's what you're doing here. And I'm grateful for the chance to be with you. Hopefully I can add something to your education that'll provoke some thought. And more importantly, since you were obviously here studying massage therapy, is that right? Anyone not studying massage therapy? Raise your hand. Hopefully we can empower you to help some of your clients and even help diagnose something that I don't think can be treated effectively with massage therapy alone. And that's called myofascial pain syndrome. Myofascial pain syndrome. Now I understand you've had anatomy and physiology, but not kinesiology. Okay, so I'm going to introduce a little bit of kinesiology. Who knows what kinesiology is? Study of muscles. Perfect, excellent. I'm a muscle specialist. Okay, orthopedic surgeon, bone specialist, neurologist, nerve specialist, physiatrist, muscle specialist. That's what we do. What do muscles like? Raise your hand, just make this real casual.
Oxygen.
They love oxygen. They love oxygen, you bet. You run, you get sore, that's lactic acid accumulation. You rest, the muscle's perfused. It takes the carbon monoxide out of the area, brings oxygen and other nutrients to the area. Then you feel better. That soreness, achy feeling goes away, all right? What else do muscles like? Massage. They love massage. Okay, excellent. Now, that's why you're here, okay? I'm happy to be here. And hopefully you can help some of my patients because I write for a lot of massage therapy. All right, I think it's nice when muscles feel good. That's a good thing. People can do stuff. They can move. Muscles actually move things and a lot more. All right. They like exercise. They like to be used. When you don't use a muscle, what happens to it? If you don't use it, you lose it. Got it. Okay. This is common sense, right? Okay. All right. What are we all doing right now? Except me. We're all sitting on our right. What's happening to our muscles right now? Our tummy muscles and our hamstrings. They're getting weak, right? Yeah. We call that atrophy. And if I talk too long, what's going to happen? You're going to get sore back here and you're going to want to get up and move around, right? Your muscle's going to talk to you. Say, hey, I need some Houston, we need some oxygen. We need a break, and get some air, all right? All right, any questions about kinesiology? That's kinesiology in a nutshell. All right, now who knows what this is? This is a spine, all right? And this is missing a head and arms and chest and a few other things, but this is a backbone without the accessories here. And this looks like a pretty straight spine, right? Okay. This person's going to have happy muscles. All right. Come here, Fred. No, not there, Fred. Let's call this gentleman Hugo. This is Hugo. What's wrong with Hugo? He's kind of falling forward there. He's got some posture problems, right? Is he going to have happy muscles?
No.
No, he's going to have very unhappy muscles, exactly. So I'm concerned about that. And I have actually been studying postural restoration. And that's what we've been researching here in Omaha quite a bit. If we can figure out a way to help improve his posture, then some problems are going to go away also. All right? What kind of problems do you think this patient, Hugo, would have? What kind of problems with that kind of posture? He's going to have a sore back. You bet he is. All right, look at the back's holding him up down here. A lot of work here, and especially right in here. Tremendous stress. Tremendous stress. Upper back pain. Ooh. Neck. Oh, man. Head. What kind of head problems? Headache. He's going to have lots of headaches. You bet he is, okay? He's also going to have some other problems. When you squish the rib cage like that forward, what happens to your tummy? Gets squished too, okay? Anyone ever have heartburn in here? Gastroesophageal reflux, okay? What happens when you lay down at night and you have gastric acid going up into your upper airway and nasal cavity? Irritates the stuff up here, mucosa, sinusitis. You plug your sinuses, you get congested. All right, things swell, right? You get swollen. When they get swollen enough, and maybe you've got a little too much weight you're carrying around, what happens? We call that obstructive sleep apnea, all right? That cuts off oxygen not only to your muscles, but also to your brain, all right? So that's kind of what I will use the term of an end-stage problem. You know, when you've knocked enough things over, then you're going to have a problem. When you've got sleep apnea, you've got a lot of problems because you're tired all the time, you're exhausted because you can't sleep well, and when you do sleep well, you actually have not enough oxygen going to your brain, you're having brain damage. So you feel worse when you wake up. Horrible headache, okay? So what do then? You go to see the doctor, right? He gives you some pills and maybe some other things and maybe make you worse because of the medication. What's another word for medication? Prescription drugs. Now, they're called pharmacists here. What are they called in Europe? In England, for example? Druggists. Right, and they have this little emblem up on the pharmacy wall in England. It's called the skull and crossbones. What does that signify? Poisons, right. You got the picture? Okay, so I think that's just to remind the patients and the pharmacists that they're not handing out candy or vitamins. These are drugs, medications, all of them, most all of them, have some significant side effects. Okay, all of them have some significant side effects. I'm going to stop there, but you understand that trying to throw medications on problems like this is a bad idea. All right? So if you can make my patients feel good enough that they can do the exercises that they need to feel better so that they can do this, I will be very happy, and you'll help a lot of people. All right? So that's what a physiatrist does. Any questions about a physiatrist? Yep, that's all right. No, that's fine. That's a page. We're going to lose one of my friends. I'm going to bring her here, and we only have her for 3 minutes, so pay strict attention. Could you join us, Sarah? I'm going to tell you a real brief story about this young lady. I think we can do this in 3 minutes.
It's all right. Take as much time
You're
as
very
you need.
kind. I know your boss, thank goodness.
Yes, that's right.
Sarah's what we call a tough chick. She's working with a mortician, and you were lifting
The body.
a body a couple of years ago.
2 years ago.
Can you kind of show us what happened?
Sure, pulling like this.
Right. What
Pulled it
happened?
back. I felt something rip down here. That's what it felt like to me, like a rip.
Okay. And then what happened? Then you went and saw one doctor, two doctors, three doctors, fourth, number four, and I gave you pills and prescribed therapy for 8 months.
Yeah.
And you got how much better?
No, none.
Maybe that much better. Okay, all right. And what happened is, and we're not going to show you, but there was a ligament that was torn down here. Just a little attachment of muscle. And so that after that happened, then there was a little nerve going to that muscle that every time she would move her leg or back, it would grab that little nerve. This is a big nerve, but it'd grab a little one and sting it so that she couldn't move, so that you couldn't sit or
Walk very far, twist, bend. Without anything,
Live.
yeah.
right? So in her case, massage therapy didn't work because when you have that muscle and that little nerve cut through the muscle, when you move the muscle, it hurts really, really bad. It's a raw nerve ending, okay? So we actually had a surgery, okay? Now, surgery was just to go and cut the muscle free. And I think that was partially successful.
Yes.
Okay. But because it went so long before it was properly diagnosed by the doctors, myself included, okay, there's her other muscles adapted. Okay. Can you take your pelvis like this and tuck under like that? Okay, why don't you stand sideways so they can see a little better? Go ahead and tuck, do a pelvic tilt as much as you can, okay? This is fantastic improvement. And you can see now she has excellent posture. But still some pain in the area. The concern that I have is that with massage therapy, she could have been diagnosed much earlier. Because if you have, for example, a herniated disc and a nerve that's pinched, the muscles are going to be unhappy, all right? But they'll respond somewhat favorably to massage therapy anyway. Now, there are exceptions here, all right? When a nerve is irritated, anything you touch in the area of the muscle or the skin that the nerve is going to be irritated, all right? But we have some very powerful diagnostic tools now, like you've heard of MRI, all right? MRI and X-rays. We actually have digital motion X-ray now where you can see the muscles moving, the bones in relationship to each other, all right? But when those studies don't reveal the answer, then we're in big trouble. Does that make sense? Okay. In this case, a massage therapist could have diagnosed her problem earlier. So I'm thinking that you can help me identify people with this myofascial pain syndrome. Because once you cut that nerve loose, or you're able to reposition the nerve, you're going to be in good shape. A pretty standard pattern that you will see, where somebody's they've been in a car accident or they've hurt themselves at work, okay, and they've got pain. Drawn here is the red, going up and down, right up into the eye, you know. So this particular patient is going to see eye doctors, and sometimes they'll see ENT doctors, you know, ear, nose, and throat surgeons, trying to figure out what's going on. And what they should be seeing, of course, is you. That would be great. All right, massage therapist. Because then, if you massage the area of concern, all right, we talked a little bit about this pain up in here when my friend Hugo is falling forward, okay? If it's just tight, if it's just too tight, overworked and underpaid muscles up here, what's going to happen when you give when you put them down on this mat and you give them a nice massage? What's going to happen? Relax the muscles, improve the blood flow, right? Right? Tight is bad. Tight doesn't work. You know, well, you've heard of white knuckle syndrome? Okay, there it is, right? If I loosen it up, oh, look. Blood is good, oxygen, circulation, right? They'll feel better. Okay, perfect. All right. But if they don't, and you find a spot, could I have that blue book that's right next to your chair there? Thank you very much. Then we're worried about something, okay? This is so amazing. Look at that. That's a computer-generated model from a real cadaver. Isn't that amazing what they can do now? That's just incredible. All right? All right. What I want you to do, what I'd like to challenge you to do, is a lot of massage therapists are great on technique. Technique is wonderful, okay? But it's not enough for you to help someone. I would like you to, if you can, one muscle at a time, learn the muscles. One muscle at a time, learn the muscles. Not all of them, but all the ones that you can. All the ones that you can work with. Because if you can find a particular muscle that's got a particular problem, then you can help me, diagnose the patient. And we'll do that in a little bit here, okay? That would be great, all right? So if you're massaging the muscle, and it should be feeling better, but instead, the more you massage it, the worse it feels. What is that?
Nerve.
That's a nerve. That's an unhappy nerve somewhere, somehow, right? Because muscles love you. Nerves don't love you, okay? unless they're healthy, then they love you even more than. I mean, the nerve's job is to monitor the muscle. When the nerve is being irritated, then we have a problem. Okay. All right. Any questions there? Beautiful. That's easy. Now, there was a wonderful physician named Janet Travell who wrote this series of books called Myofascial Pain and Dysfunction, and she was a physician to John F. Kennedy. And she was, I'm going to say, she was a great massage therapist. Based on her knowledge of kinesiology, she knew muscles. And she actually, even though she didn't know what I know, because I live in Omaha, much later, she was able to figure out, well, if we stretch this one out this way and stretch that one out that way, and then sometimes you'll stretch that nerve loose, okay? Then it won't be caught. It'll be literally torn loose, all right, stretched loose. And to accomplish that, they were doing things like, and you can't see this well here, but they would spray the equivalent of Freon, ethyl chloride, on the skin, so that freezing sensation would cause such a distraction to the brain that even though they were stretching that muscle out and kind of getting that nerve loose, the patient wouldn't feel it because they'd be feeling the freeze. Okay, that's what would be happening. Or go ahead and inject hypodermic anesthetic and numb it up and then stretch it out like crazy. Okay, that is the conventional way to treat myofascial pain syndrome. All right, all right. The problem is it doesn't work very often. Okay, at least we don't have anyone in this state that I know of who can do that successfully. There's a couple of people that are pretty darn good at it, but I've sent patients to them and no one's gotten better so far, knock on wood, hopefully someday, right? So I think that there may be a problem where it's caught. Now, if I could invite Kelly, want to come forward? Kelly is another tough chick. She can throw me across the room, no doubt. Can you tell us what happened?
Well, I was in a car accident.
Okay.
Got hit from this side, and my arm was sitting.
Right.
It came from right here, going. I don't remember if it was 40 or something. Hit right there. My arm was in the door, and it came in.
So that's a blunt trauma to her left side. And how many doctors have you seen so far?
Well, mostly just my family physician I started with, and then went to my orthopedic surgeon who did my sports injuries that I've had, surgeries, and then I guess you,
Yeah.
and one other, yeah.
So a bunch, 4 doctors.
4 or 5.
Yeah. Okay. And I know your surgeon very well. These are good people, and everyone's helped you, right?
some way. Tried to, I guess. I don't know. It just it comes and goes.
What still bothers you? What still hurts?
Just everything up in here and
Okay.
down and my neck.
How long ago was it?
It's been over 2 years.
It's been over 2 years. How long does a blunt trauma muscle injury usually take to heal? Actually, normally, a few days. You know, you work out really hard, your muscle's sore for a few days. If you tear something though, okay, it can be a few weeks, but we're talking about months, years. Okay, how long does it take to heal a bone? You break a bone, put it in a cast for 6 weeks. I'll say 4 to 6 weeks, depending on your age and so forth, how much of a fracture and all that. So 2 years, that's a big deal. And you don't exercise, right? Never?
Yeah.
No.
No, I do.
She exercises. She's done everything I've asked her to do in terms of exercise, strengthening, conditioning, and she's strong. But there's just a couple of things that still hurt quite a bit. Now, who's the best massage therapy student here? Who's the guru here? All right. Look at that. They got the finger thing going here. Okay, great. Okay. Would you mind if you give us a little shoulder massage? Okay. Okay. Now, this will be very limited. Now I'm going to watch your face, and you're going to help. You're going to help. What's your name?
Gary.
Gary. Excellent. Kelly. Gary. This is Kelly. Kelly. This is Gary.
Kelly, pleasure to
Okay.
meet you.
Thank you. A little therapeutic relationship established there. Okay. Good. All right. Where's it hurt now?
There's like an
Right
area that's
there.
kind of, well, it's elevated and
Okay.
in there.
Yeah. Okay. Very good. All right.
And then it's
Yep.
down under my shoulder blade.
Right. Okay. Good. Now tell them when it hurts. So far, nothing's hurt.
Well, it hurts anyway.
It hurts
Right now, today. Yeah.
Oop, right there?
Yeah.
Oh boy, yeah, it does. Oh my goodness. Ouch, ouch, ouch. Thank you very much. Okay, right there. Okay. Now, who knows the muscles right here? We've got rhomboids going like this, right? And we've got the traps coming right up, right like this, right? Okay, down there. Now, levator scapula. Very good. Is deep to all of them, actually. Kind of deep down underneath. Now, if you raise up both shoulders, does that hurt?
No worse than.
Not worse than usual,
No.
right? So who's lifting the shoulders? Mr. Trapezius, right? Okay, lift them up high again. Okay, if I push this side, that does not hurt. So that side of the trap doesn't hurt at all, nor levator scapula. Okay, now how about putting your arms out like that? Go ahead and push up. That doesn't hurt?
It burns.
That burns when you do that. Okay, but
Just like, because it always hurts here and then
Right.
kind of down.
okay.
I don't know.
And that's where, remember, she got hit on that side. So there may be some unhappy nerves in here also. But you've got good range of motion in the shoulders. Yeah, good strength. Anything, and go ahead and move roll around. Anything wrong with the,
Popping, but.
there's a little popping. Okay, do you have it on this side?
Mm-mm.
Try this side. Nothing there,
Well,
a
it
little bit.
popped over here when I did that.
Yeah, okay. So what's the popping? Now, it wasn't popping like that before the accident?
I've never, no.
No, okay. So what's that popping signify?
Air?
Not air,
Yeah.
actually malalignment. Malalignment, okay. Something in the biomechanics has changed about the joint so that now when she moves it, it pops. Now you'll have this, if you loosen some ligaments in the neck, if you tear some ligaments, okay, you'll have some clunking. And that can be very, for old folks like me who are losing their hair, oh yeah, everything's clicking, okay? But for young people, that's distressing because something has changed. It used to not do that click thing, okay, when you were younger, all right, or before the accident. So thank you very much, Gary. Okay, now, what he did do very nicely, I think very accurate, is identify that there's a sore spot right there, okay? And your instructor mentioned the muscle, and I think that's probably the problem. It's levator scapula. For some reason, and this is not too bad down here.
Where you just touched last is not, yeah,
Right
that's,
there,
there's
okay.
some weird pain there
There
that I
is some weird
don't
pain
normally
there.
feel.
Yeah, that's probably from your therapeutic touch of the doctor, right? Okay, no, so that the rhomboids go from the shoulder blade and connect up to the spine here, right? That's what the rhomboids do. And how do you test the rhomboids? Can you reach behind you with this hand? Just like that, yeah, and push back. That's one way to test the rhomboids. Okay, and no pain there at all. Same thing on this side. Okay, and reach back and push. Any pain there?
Just burning, like
That's
I
the
don't know
burning.
how to.
Okay, no, that's a good description. Beautiful. Now, any ideas about how we can help this young lady? Should I give her?
That along with our alignment.
Yeah, that could be. But what's out of alignment? Is it the spine or is it the shoulder girdle? It's the shoulder girdle itself. Okay. Now it's possible that there's an alignment problem in the spine also, but we've done x-rays. We haven't seen anything overt. And we haven't tried chiropractic yet? Because I do that a lot, actually. We didn't do that. I think that...
I'm not extremely comfortable with the idea of
Right.
it.
Well,
But-
I think chiropractitioners can do a lot of good things, especially for helping to mobilize the neck and the lumbar spine and the pelvis, lumbopelvis in particular. But it's a lot more difficult when you're dealing with the thoracic spine because of all the other structures in the neighborhood. It's hard to realign something that's got all this stuff attached. In fact, it can be very painful when you try it. I have many times, all right? So that would be certainly reasonable to try. But you'd want to be careful and you want to make sure that he or she, the chiropractor, were quite aware of the muscle pain. Now, theoretically, some people would say that if I put the spine back in alignment, then the nerves going to those muscles would be happy. And that is a possibility. That is a real possibility. I think chiropractic can do that for a lot of people, for a lot of things. All right. Any other ideas? We've got muscle pain in here. And actually, massage would be great. Now, have you had a massage?
I did deep tissue massage therapy for probably half a year,
Half a year, yeah.
I believe.
And was that consistently making it feel better
The whole time it was awful.
the whole time?
And then, yeah, it was the most painful. Like, it was painful.
Wrong person. Oh, sorry, Jeannie.
It wasn't awful. It was so painful to touch in on
Right.
that, and they focused on that. But I did it, and it started feeling better, kind of, but not significantly enough where I felt like there was any difference.
Okay, well, that's very kind.
Was that a bad comment?
No, that was unfortunately. Well, that's why I asked you to come to help out these people, because what does she have? Probably myofascial pain syndrome. Okay, why do we think that? When we're activating the tissues, using those specific muscles, levator scapula brings and that's when she hurts the worst. And I didn't even do that. Is when she brings up that shoulder blade, and I push down. That's what hurts the worst. And I'm not going to do it because I've already done it. All right, but even just abduction. Lifting her arm up, those deltoids, because she's stabilizing with something here, and it's hurting. Anything she does to stabilize her scapula,
Putting my hair up is when it catches a lot.
that's disaster. Yeah, because you got to stabilize to lift that arm, right? So I think she's got myofascial pain now. Unfortunately, the reason I asked Kelly to come is that muscle's too deep. I don't have anyone that can get to it safely, surgically. Okay. So I don't have a solution for my friend here. So if you have any ideas, give me a call. Any questions? You're a dear. Thank you very, very much. We should give Kelly a hand because she is a great too. Now that I've shown you the limitations of the thinking, I think it would be reasonable if I show you just some other ideas about this. Now, as massage therapists, you're all educators. This is something that I just noticed recently, very recently. All right. I've seen about 7,000 patients here in Omaha. And I have the unpleasant statistical realization that I have not helped any one of them while they continued smoking. Cigarettes, How common is that? 15% of the population smoke. I mean, it makes people feel great. It relieves tension. I think 40% of nurses smoke in Omaha. Whoa, nurses. Aren't those people taking care of people on ventilators? And can you spell heart disease, cancer? Okay, that's what I'm talking about. The caretakers, right? You got it. Okay. Why do they do it? Okay. Well, there's a couple of reasons. It feels good. What it does is, come here, Hugo. Nicotine does a very excellent job of sending blood to the brain and the big muscles. Brain, big muscles. Feel good, right? Oxygen, we talked about that circulation thing. Oxygen is good, okay. Something that you put in your body that sends blood to your brain and your big muscles helps you feel good right now and relieves stress. Oh, it feels good, okay. That tension stuff, you know, it's blood doping if you want to think of it, okay. That's not a bad thing in and of itself. In fact, it's great if you're fighting dinosaurs or running away from, dinosaurs, or we call that a fight or flight response. It's that same sort of physiological phenomenon. That's what nicotine does. Unfortunately, you can buy it in these little packages now and put it in your pocket, and then you can light up and do it all the time. When you do it all the time, then you're sending blood to your oxygen, or you're sending blood to your brain and your big muscles all the time at the expense of your skin, your joints, your spine, and your GI tract. Okay. In other words, it comes with a cost, all right? And there's one other cost that's unfortunate. When you burn the tobacco to get the nicotine, which is the drug that you want, there's a side effect because there's something generated called carbon monoxide. Ow. Okay, what does carbon monoxide do? That's the bad part. It does. How? That's what I want to show you. And I'd like to thank my dog who loaned me her toys so I could do this. All right. How is blood sent around? You've had physiology. How is blood sent around the body? Okay, first of all, I got to start here. What am I doing with this myofascial pain talking? Why am I interjecting smoking? Okay. How many people have friends who smoke? Raise your hand. Okay. Any questions? I want you to do what I'm doing right now. If you love them, you get them to quit smoking. 7,000 patients who I didn't help is a lot of patients. Now, if I got them to quit smoking, they all got better. All right? That's a statistical fact. 7,000 people. Dr. Gold helped how many? 0 if they kept smoking. If I got them to quit smoking, I helped all of them. That's just incredible. And I didn't realize that until I'd been practicing for like 5 years. All that college. Okay, this is hemoglobin. Hemoglobin is the purse your blood uses to carry oxygen around the body. Okay? Hemoglobin is basically a bag. Hemoglobin grabs oxygen. This is oxygen, pink. Okay? Okay, oxygen in the hemoglobin, catch. Okay, takes it to her. She's so cute. And you're going to give me a actually, this is a carbon dioxide. Carbon dioxide here. You give me the carbon dioxide. You get the oxygen. And then I take the carbon dioxide. And I go back to the lungs. Okay, and what do? Bye-bye carbon. Yeah, get rid of the carbon dioxide. Okay? Great program. One problem. What's this? Carbon. Ooh. Carbon monoxide actually looks like carbon monoxide. It looks like carbon dioxide a little bit, little spiky things, and it looks like oxygen. In fact, it's virtually identical. And in fact, it's so close, not only does it fit in the hemoglobin sac on the receptor site, it fits better. See, isn't that a nice snug fit? It fits better than either carbon dioxide or oxygen. So what happens now, right? Here's the blood carrying the purse out to the muscle. You're such a cute muscle. Okay, and what happens? Nothing. Why? It's stuck. So she gets to keep she doesn't get any more oxygen. Sorry. Okay. Sorry, Charlie. And she gets to hold on to Are you allergic to dog spit?
No, I have a dog.
Excellent. Okay. She gets to hold
I
on
had a
to.
comment. I said, that looks like my dog's toys.
It probably is. It close. This is great. Probably go to the same place. This is the carbon dioxide. It stays there. Remember the soreness in the muscles? Okay. Do you want to help your friends? You understand what I'm talking about? Okay. End of smoking lecture. All right. That's important, though. That's very important because if we can get them to quit smoking, half of them are going to get better without a doctor, which is great. I mean, that's all you have to do is just add oxygen. Try it. Okay? Now, back to the myofascial pain thing. This is from Janet Travell's work. You can see here, and if you can't see her, please move just a little bit. This is upper trapezius. Here's trapezius, okay? She was focusing on trigger points, places that you touch and they hurt. Okay? Kelly's trigger point is where? Gary, where is it? Bingo, right on the money. Ouch. It hurts there, and the neighbors hurt with activation. Everybody overlying that tissue, when I activate it, be it supraspinatus or the rhomboids or trapezius, they're all going to hurt. Even just stabilizing her scapula so she can use deltoids, which are way out in the corner, that hurts, that burning, okay? And it's probably because levator scap is, she's got a trigger point there, deep. And if I give her an anesthetic injection there, I can probably eliminate that pain locally. Did we ever do that?
When I went to that surgeon, they gave me one like
Oh, he did it.
right
Ooh.
in the
Yeah. Did that work?
temporarily.
Like 30 minutes?
Whether because it stung and I just wasn't thinking about the rest
Yeah.
of it.
Understood.
But I think it did for a short period.
Like
Once
30 minutes?
I left the office and it just
Then it
kinda
came
wore
back.
off real quick, I think.
Okay.
Or
Thank you. That's helpful. Okay, levator scapula, trigger point. Trigger points. Here, here. That's the pain pattern. Look at the pain pattern. Face, eye, bizarre. Okay? Here's another one. Same muscle. This is trapezius. Same muscle, trapezius. Down here, trigger point there. That's not Kelly's. It's close. Hers is over here and deeper. Okay? And here's another one over here. Look at that. Okay? What am I saying? I'm saying that you can have a trigger point just about anywhere. This little problem can be just about anywhere. So don't close your eyes. Keep your mind open because this is a brand new field. The pain patterns have been charted in this book by these people. They don't even know what's causing it, okay? But they've been charted just by observation, okay? Here's the sternocleidomastoid. Similar, isn't it? Very similar. Very similar. I give Botox injections to this muscle, and it cures it for about 3 months until the muscle recovers from the Botox and starts to work again. When it starts to work again, what happens? Irritates the nerve. All right? Very interesting stuff. Okay, that's all the stuff we looked at. This is how we diagnose it exactly, and this is probably what happened with Kelly. Is the surgeon probably put it in there at a certain level. But look at all those layers of muscles. This is not a simple deal. This is complicated. So who has a PhD? Any PhDs here? Good. So you're all game to do a PhD. Excellent. Okay, PhD anatomy, all right? Because we need your help here. This is a new field. That same patient, those are all the things she's been labeled with. Crazy, magnifying, malingering. Since the doctor doesn't understand what she has, then the patient must be, ooh, that's hurtful. What does that do to your self-esteem? Ooh, not good, not good. Okay, and I'm going to skip a lot of this. There's different kinds of pain. This is the good stuff. Nociceptive, that's when the nerve's doing its job. I touched a hot plate. Ouch. Okay, the nerve's done its job even before my brain says, hey, that's hot, take your finger off. Your finger's already off because of the spinal reflex. The nerve doing its job. Okay, nociceptive pain, beautiful. Neuropathic pain is when the nerve's damaged itself. Then it hurts all the time if you do anything with it. In fact, it hurts even when you don't do anything. Does anyone have any questions about how to diagnose myofascial pain syndrome? I think, Gary, you did a very good job. How do you diagnose myofascial pain syndrome?
I'm not quite sure.
See, you massage, you do a great massage. You do a great massage. Relax everything that you can. Relax everything that you can. Stay away from the bad spot. Do the bad spot last. All right? If you can then go after the bad spot, and by the bad spot I mean the tender point or trigger point or the tight muscles, the problem children. Okay, if you do that last, and you've got the neighborhood calmed down, then I think you can isolate which muscle is having the problem. If you can do that for me, then some of those patients, first of all, you're going to blow away the bad spot. Okay, and a lot of people, if it's just a tight muscle, it just needs a massage, it just needs to be milked. Okay, you're gonna cure them. Go home, they'll be happy, they'll love you forever. If, on the other hand, you've done everything you can to protect that muscle by relaxing the neighborhood, and then you go after it, and it still hurts like crazy, and you cannot make the pain go away with manual therapy, massage, that's the myofascial pain syndrome. All right?
But if Kelly comes in and tells me she just had an accident,
Right.
and I ask her, her range of motion with
Right.
her arm, because she says she has burning sensation.
Right.
I'm not going to want to touch that.
Right.
At all.
Probably not.
First thing I'm going to do is I'm going to send her to you.
Right, or an orthopedic surgeon, make sure that she doesn't have a rotator cuff tear. You don't want to massage torn things. Good? Brilliant. That's it. Most of the people coming to you will not be acute like that. Some of them will. Some will. Because I think that's the best thing in the world when this is an interesting concept. If you sprain your neck, what do you want to do? You want to get out and work it really hard, really? No, what? Rest, ice, compression, elevation, right? That's what you do if you sprain your wrist or you sprain your ankle or you sprain anything else. So I put people in a collar. I put them in a collar for weeks. Emergency room doctors think I'm crazy. But hey, you know what? It works. Immobilize it. Let the tissues heal. Let the tears tighten up. But what happens then? Then we got a problem. Then it's tight. That's when I'm going to use my chiropractor. Take the collar off, go to the chiropractor. Beautiful. Get it moving. Okay? And after it's moving, all right, then what I'm going to do? Then I'm going to massage actually you can do the whole time. Okay? Literally. Okay, right after the collar comes off, massage therapy would be great. But after exercise, then strengthen it. Strengthen it last. Okay? Immobilize, then remobilize, then strengthen. And the massage is going to help several times during that process because they're going to be sore muscles, sore, tight, unhappy muscles that want more oxygen. Okay? And then they're going to quit smoking and everybody will be happy. Okay, no. All right. Any other questions?
In the case of Kelly, does she have to live with this pain for the rest of her life, or is it going to be just chronic pain? Or?
I am depending on this group to find a cure. Yeah. That's your homework. That's it.
Do you ever send patients to physical therapists?
Constantly, daily,
And
more than
chiropractors
daily.
as well?
Yes, everything. You name it. If it works, we want it. Right. Yes. I rent from a physical therapist who hired one of your graduates. And she's fabulous. And she says, howdy, your name's Carissa. Remember Carissa? She's fabulous. She's a PT aide / massage therapist. And she sees a zillion of my patients. And she's fabulous. You're getting good instruction here in terms of massage. That's why I say the technique is not an issue here. You guys have excellent instruction here. But I want you to go to the next level. And if you can help identify those patients with myofascial pain syndrome by finding trigger points. You find a real trigger point, that's not just nociceptive pain, that's not just an unhappy tight muscle, that's a nerve that's being pinched. And we've got to figure out that, and then what do we do? We've got to figure out some way to unpinch that. Now maybe that is going to be mobilization, maybe it is going to be adjustment of the chiropractor. I don't know. I have chiropractors that come to my office once a week from South Dakota to see special patients, to do digital motion x-rays. Once a week I have a chiropractor from South Dakota come down because he knows what to do. So I bring him down to my office, right? Whatever it takes.
So as massage therapists, if we find a problem, we send them to you. What do you do?
Or someone like me. What do I do in this case? What I would do is try to find out exactly where the trigger point is, where the myofascial pain generator is. Once I've identified the source, then in Kelly's case, I try to stretch out the whole neighborhood. If we can stretch it out, that would be great. Then try to strengthen the support muscles, the ones around the problem area. Sometimes Mother Nature, never underestimate Mother Nature. She can heal things, okay? We get people to quit smoking, we get people to lose weight, we get people to do nutrition stuff, okay? Anything different. If you do the same thing, you get the same results. If you do something different, you'll get different results, all right? Chiropractic, if that's appropriate. If they're just, everything's locked up, a chiropractor would be wonderful, okay? If they're weak and deconditioned and their posture's like this, that's easy. I mean, that's strengthen the hamstrings, pull the pelvis back into alignment. Strengthen the abdominals, hold it in alignment. Then work the upper body, Pilates. Okay, standard physical therapy. If all of that fails, then I come into it. Needles. Decadron, lidocaine, Marcaine, saline, hypertonic glucose.
It's temporary solution.
Some of it is not. About 15% of the trigger point injections work. 15% works. In other words, I give one shot, they're cured. That's 15% of the patients. Okay. What I normally do, though, is identify where the problem is, and I send them to a surgeon. And he or she tries to do this. And that's really cutting edge, all right? And that is pretty amazing. But it's got to be, I've got to know exactly where that problem is, and it can't be too deep. It's got to be accessible. So we have experience, but it can happen anywhere in the body. Did that answer your question? Okay, so in other words, whatever it takes. All right, thank you very much. It's been a great audience.
Thank you.
All right.